the update I sent last night, but it updated yet again today. So I'm going to go ahead and put the updated agenda into the chat. You should see it there so that you know what we're going to be discussing today. And I just wanted to let everybody know, and especially our presenters, I like to be pretty flexible with presenters if I can, but we're on a very tight time schedule today since there's so many things to talk about and so many great updates. So just wanted to throw that out there in case I need to jump in and ask to close up and have final thoughts on whatever you're presenting, just so that we can stay on time and respect everybody's time here. So I wanted to give that advance notice. So sorry, I can't be a little more flexible. Normally I've got some time scheduled in for that flexibility, but not quite as much today. So with that said, I think we're going to jump right in. We have 2 partner shares scheduled today, which I'm really excited for. Is Sandra here? I think I saw them sign in.
Hi, Misha. Hi, everyone.
Hello. The floor is yours.
Thank you. Sandra, she, they pronouns. I work for Oregon Food Bank. I'm the Resource Access Manager, and my team is supporting the expansion of Double Up Food Bucks into grocery stores. So I wanted to share a video and share the website. I'm hoping I can share my screen. I'm going to try to do that now. But we, so the Double Up Food Bucks organizer on our team, and now I can't see everything in my screen is tiny, but I hope you all can see
We see it, you're good.
Okay, perfect. So the Double Up Food Bucks organizer on my team worked with community members, our comms department, and Brinks to transcreate an explainer video for Double Up Food Bucks, which I think is helpful because the program is a little bit hard to understand for community members. So the video is available on the website in English and Spanish, and there's also links to the video in Russian, Vietnamese, Cantonese, Mandarin, Korean, Somali, and Arabic. So I want to share the one in English. Can you hear it?
We don't hear it. We see it though.
Okay, I might have to stop sharing and start again. Sorry about that.
There should be a place to select share computer
There's sound. Yeah.
Yeah, there you go.
Buying nutritious and fresh, locally grown fruits and vegetables just got even better with Double Up Food Bucks. How? When you use your Oregon Trail EBT card, also known as SNAP or food stamps, at participating farmers markets and grocery stores, Double Up Food Bucks doubles each dollar you spend. Here's how it works. Let's say you spend $20 using SNAP at a participating farmers market or grocery store. You can get $20 more in Double Up Food Bucks to spend on fruits, veggies, fresh cut herbs, or a Veggie Start. That's an extra $20 of fresh fruits and veggies for you and your family. Do you buy produce through your local CSA? When you pay with SNAP, Double Up Food Bucks will pay for up to $250 of your annual share. Find out how you and your family can enjoy more fresh, delicious fruits and vegetables all year long. Just visit doubleuporegon.org and learn more about how the program works and which grocery stores, farmers markets, and CSAs participate in Double Up Food Bucks. That's doubleuporegon.org. Double Up Food Bucks Oregon is made possible with support from our partners, Farmers Market Fund, Oregon Food Bank, and Pacific Northwest CSA Coalition.
All right. On the website, there's also the option to look at locations where Double Up Food Bucks is accepted. So you can click on the interactive map, and it has logos for like the CSA, for farmers market, and for grocery stores. So I wanted to share this resource. So hopefully for folks that are working directly with community members that utilize SNAP, that, you have this tool now available. And yeah, that's pretty much all I wanted to share. Thank you so much.
Thanks, Sandra. I did include the link for this in the agenda, but Sandra, if you wouldn't mind throwing that in chat as well, I'm sure people would find that very helpful. Thank you. All right. Is Anna here? Ah, there you are. Good to see you. Anna is going to present on Rideline for us today.
Hi, thank you so much for the invitation. I do appreciate your willingness to invite me and have me present information about Rideline services. I just want to let you know that I work for Rideline, which deals with clients in Lynn, Benton, and Lincoln counties. However, the brokerages are throughout the entire state of Oregon. So regardless of which county the OHP client is in, they do have transportation options. We can set up an account for individual clients with OHP, get them to and from any covered appointment, non-emergent medical transportation. And this does include bus tickets for some clients that need to go, for instance, out to Baker City for treatment centers or mileage reimbursement. So if a client is willing to drive themselves to a medical appointment, we can offer to reimburse at 25 cents per mile. It takes about less than 5 minutes to set up the account, and you as the managers can call in conjunction with the client, or you can call in and then we can follow up later on with the individual client, whatever works best for the client, and get that person started with those services. And our transportation operators operate 24 hours a day, every single day of the year. Our office, however, is only open Monday through Friday, 8 a.m. to 5. But please reach out. Anybody in the call center can set up the account. And I just updated my the website, so you guys can go there. And then previously I had my personal contact information if you want to reach out to me directly. And if you're interested in me doing a presentation to your smaller group locally, I can do that as well.
All right, thank you, Anna. Any questions for either of our partners who presented today?
I actually do have questions.
Sure.
I want to start with Sandra. That's really rad, but I know I'm about to get a bunch of people asking me, how does the double up occur? Does it occur at the time of the transaction? Or some other, maybe you can shed some light on that before I ask more questions.
Yeah, so that's one of the things that is kind of tricky about the program, is that it kind of depends on where the person is shopping. Because it has to do with the point of sale technology that they use. We are looking into what it would take to get Double Up Food Bucks integrated into the EBT card, but that's a long-term project, so it really kind of depends on the location. Wish I had a better answer.
But so let's pretend they're at the farmer's market and they're buying $5 worth of produce. Will they get, does it work more like a buy 5, get 5 at the transaction moment, or?
I'm wondering if anyone from Farmers Market Fund is on the call that could better answer that question. I believe, I'm not sure if all farmers market locations use tokens. Is there anyone from Farmers Market Fund? Sometimes there is.
I do not, but I have been a farmers market vendor at several different farmers markets in the Mid-Willamette Valley, so I could speak to that at least. At all of the local farmers markets to the Salem, Albany, Corvallis, and I believe Eugene areas, somebody correct me on Eugene if I'm wrong, the customer would want to go first to the information booth at the market and decide how much they want their SNAP card to be run for. So let's say $20. The person at the information booth would run their card for $20, give them $20 worth of whatever the tokens are that are unique to that farmer's market, and then would also give them little cards for the Double Up Food Bucks. They're little cardstock, colorful things with the year printed on them because they do expire at the end of each year. And then they can go use those tokens, which are from their SNAP card, for any food, which could include, cheese, meats, that kind of stuff. And then the Double Up Food Bucks cards can be used for fresh produce, plant starts that are food, herbs, I believe also dry beans and grains. So yeah, most markets, especially the small to medium sized ones, have a token system. I'm actually not sure for large Portland area markets. If somebody can speak to that, I'll be grateful.
That's super helpful. But do you know, so you said they work through the end of the year. So if they couldn't, maybe they were waiting for, I don't know, peaches to come in and they weren't in that time, they could come back and that money would still be on that card in that calendar year and they could use it later?
Yep, they're just little voucher cards.
Love it.
When I previously had SNAP, I would not necessarily use all of my Double Up Food Bucks as a customer each week. And so, yeah, they just go in my wallet and then I would use them the next time I came to the market, as long as it was within that same calendar year.
And they can use it at multiple markets. So like if they started getting the card maybe in a Tualatin one, but for some reason now they're in Tigard farmers market, they could still use them.
As long as that market accepts Double Up Food Bucks, yep.
Okay. All right. Thank you. Sorry for so many questions.
And that wouldn't necessarily be the case for all grocery stores, because they do have different, like some you'll get a printout on the receipt and then you have to come back to the store. Other locations have different POS technology, so they're able to just have it in their system and the person just comes back. So yeah, it really depends on the location, but they do, each location is able to provide that information, and usually they have some signage too that helps with all those details.
All right, great question. And I am sure, Linda, that you're not the only one who wondered that information. So I appreciate your asking and for everyone's help in getting that answered. I think that's wonderful. We've got 1 more minute left. Any other questions for either of our partners?
I do for Sandra. Am I correct in believing that there's a $20 limit? You spend 20 and then you get an additional 20? Okay.
I just have a question for Anna, with Friedline. Can you all hear me okay?
Yeah.
We hear you. Go for it.
Okay. Is it just clarifying, if we're working with a young adult who needed transportation to a WIC or to WIC, do they have to have an appointment? And I think we were told it needs to fall within, let's see here. They need to sorry, I'm having some background noise. They need to have an appointment for certification, recertification, or any type of follow-up with a dietitian. I'm just wondering what that, if any type of follow-up with a dietitian, does that mean it has to be a scheduled appointment, or can it be drop-in?
No, I believe it does have to be a scheduled appointment because it's going to be billed to the Oregon Health Plan. And that's always our fallback guidelines. If it's going to be billed to OHP, most often that's going to be a scheduled appointment.
And there's, is there any times that it wouldn't be billed to OHP? Is there any advocacy around that, if that's a barrier?
That I cannot answer, but
Okay.
that's something that I can bring up to my supervisor and ask if there's any time. I know when the WIC entry for the database, it does say it must be certified, recertification, or the dietitian appointments only. And that's for the client, or that might be an infant that's, their first time going through the WIC program. So
Yeah, it just didn't outwardly say appointment. It just said any type of follow-up is what it said, any type of follow-up with a dietitian. So that was broad, and we're trying to problem solve, but we don't want to send them down a bunny trail that is just a hard no. Or if there is advocacy there, what that would look like.
yeah, well, I can double check with my supervisor and get back to you.
Okay, that'd be great. I
All
could
right,
add my
thank you.
email to the
Okay.
chat. Thank you.
Sure. Any other questions?
I don't think so.
Okay, I'm going to go ahead and log off, and thank you again for the invite, and hope to speak with some more of you guys later. Bye-bye.
Okay, Anna, really quick before you go, Do you
Mhm.
hear me? Okay.
Yep.
Can you CC me on the information you send out regarding that question so that I can make sure our partners receive that
Yep.
answer as well in case they're curious? Thank
Okay,
you. Appreciate
sure.
it.
Bye-bye.
Bye-bye. All right. Great presentations, great questions. That's wonderful. If you are interested as one of our partner organizations and also presenting, please reach out to me. We'd love to have you have a moment just like these two did. Our next presenter is Jen, who's going to be talking about the childcare changes coming up real soon here. Jen.
Yes, hello everyone. Thank you for having me today. I feel like I've shared this information in so many different places, so I'm sure that some of you have already heard this in some different venues. So let me see. I think now you should be able to see my screen of the presentation.
We see it.
Okay, perfect. So basically, I am sharing a little bit about the ERDC eligibility expansion and then our migration that's coming up in less than a month to the new Department of Early Learning and Care. So the main reason for the new department is essentially to pull together different areas of the child care program and bring it under one roof. So we've got the early learning division, the child care program, inclusive partners actually already migrated over from ODHS about a year ago. And then we'll have our new shared services that will be part of the Department of Early Learning and Care, and that will start July 1st. We're just very excited to have this focus and to be a part of a department that has a mission of really serving children with high quality care and focusing on how we can support the families and also the child care providers. So some of the things that I'm excited about a lot of things, but for the employment related daycare program, we have a lot of different changes that are coming, but we also wanted to have some pictures here of what's actually staying the same. So there's a lot that will be staying the same for families in particular. That how they access the ERDC program is not going to change. So they'll still be able to apply online, call or go into local ODHS offices. They'll still need to use an ERDC approved provider. They can still submit paperwork and listing forms to the ODHS branch offices or report benefits through the one.oregon.gov website. We'll still be supporting families to use 211 info to do searches for childcare providers, as well as the information for childcare facilities will be on the DELC website. So instead of the Early Learning Division website, it will be on the DELC website. With our direct pay unit, they're still going to have the same hours, same PO box, same phone number, and then the phone number for the Office of Child Care will remain the same as well. But the things that we'll see that will be changing, especially for families, and this is a big change, is that families will be able to receive cash assistance and childcare at the same time. So though there currently is the TANF Jobs Childcare Program, we're actually going to be incorporating that childcare into the employment-related daycare program. So we'll have one childcare program that will serve all families who are either receiving cash assistance, who are working, or attending school. The families will see fewer reasons that their cases will close. And families who are on TANF will be able to ask for ERDC childcare when they're speaking to their family coach. We're also going to see a lot more opportunities for families to actually engage in the policy and rulemaking process, which is really exciting. And then you'll see information about ERDC added to the DELC website with different resources. And then we'll also have quick tips for families available there as well. And so for partners, some of the things you'll see is that billing, payment, licensing, background checks, all of that will remain the same. We'll still be in the same forums where you've met with us before. So whether it's advocacy calls or the Early Learning Equity Committee, also we'll continue to attend Early Learning Hub and CCR&R meetings. So all of those engagement points will still remain the same. The Oregon Program's eligibility notebook, which I'm not sure how many of you are familiar with that, but this is basically a manual for eligibility for multiple programs within the the Oregon Department of Human Services. So it's an online manual. It's primarily meant to be a resource for eligibility workers and family coaches as they're processing information, but it is also public facing, and so people can see that information as well. So ERDC will remain in that eligibility notebook with other programs like TANF, CASH, and SNAP, and then also the refugee programs and some of the medical programs. And then we'll still continue to use some of the same collaboration tools like Google Docs, so there won't be any changes to those processes. But the things where you will see changes is that DELC will be now overseeing the employment-related daycare program. Same thing with how parents will be able to engage earlier on policy changes, and rules will also have more engagement opportunities for partners as well. So we are excited about that too. And then starting July 1, we'll see the rule set for the employment-related daycare program, and actually all of those will move over to Division 175 of Chapter 414. So we have a whole new rule set. It's actually a lot more simplified than if you look at the rules as they are now. So that'll be a really great change. Our email addresses will change, so they'll be at that at delc.oregon.gov. However, the old email addresses will continue to forward through the end of this year. And see, we will be sharing out some rebranded materials. I know some of those won't be coming out until closer to July 1, but you will see that with the from the ELD to the DELC branding, and then also the ELD website, as well as some of the childcare websites will redirect over to DELC. So apart from that, moving into some of the eligibility changes, which I'm very excited about. These have been a long time in coming. One of the biggest changes we have is that families who are receiving TANF will also be able to receive employment-related daycare at the same time. So TANF is the temporary assistance for needy families that provides cash assistance. And then employment-related daycare, though the name might be a little deceiving, it's the child care assistance program. So families don't necessarily have to be employed. Like I said, this includes families who are working, non-working students who are attending school, as well as families who are receiving cash assistance. And so all of that will be updating July 1st. Some of the things that we'll see is that families who are receiving ERDC, they'll now have the opportunity to apply for cash assistance, which prior to July 1, families had to make a decision between if they wanted to receive cash assistance or if they wanted to receive ERDC. There were very few circumstances where we would allow a family to receive both at the same time. And this is all going to change July 1. So when an ERDC family they experience a job loss, or they're on unpaid leave from work, or if they just are underemployed, so they're not making more than the TANF income limits, these families will be able to apply for ERDC at the same time as well. And when I talk about ERDC as well, so not only with the name and saying what we cover, these are some of the items that families can use the child care for. So it's not just work, it's not just for schooling, but it also includes things like medical leave or for family well-being activities. And family well-being activities really depend on what the family needs in order to improve their health and well-being. So this is a really broad subject, or a broad category that allows families to use childcare when they need it. And then for our TANF families, their childcare coverage is going to be called categorical ERDC. So essentially we're saying that of all of the different eligibility criteria for the employment-related daycare program, we're considering most of those criteria to be met simply because someone in the family is receiving TANF. So this includes even the piece about childcare needs. So a TANF family, they do not have to be participating in a jobs plan or looking for work in order to qualify for childcare. Because they're receiving TANF, they will automatically be eligible for a part-time authorization of hours for childcare. So as I said before, for families who are currently receiving TANF, they'll be able to ask for childcare assistance. And then for families who are currently receiving ERDC, they'll be able to apply for TANF if they're income eligible and if they meet the criteria. And then also for new families, when they come through the doors, they'll be able to request both types of benefits at the same time. So this is really a pretty big expansion of who can receive the benefits and when they can apply. And so with categorical ERDC, this is a 12-month certification period, and there is a zero copay. And that's regardless of what happens to the TANF benefits. That 12-month status and the zero copay will continue the entire time. So we've seen in these examples, if the TANF benefits end because the family received a job or their TANF eligibility ends for any other reason, that ERDC 12-month certification will continue going and there won't be a change to it. For standard ERDC recipients, even if they're just a few months into their ERDC certification, or maybe 10 or 11 months into their certification, if they apply and qualify for TANF, they will automatically get their certification extended for a full 12 months from that point. And that will have a zero copay, and they'll maintain the same hours that they had when they were on standard ERDC. So if they qualified for full-time hours or more than full-time hours, that will continue through that categorical eligibility period.
Hey, Jen, I'm sorry to interrupt. We're 3 minutes over. I have to get to the next person on the agenda. Are we about for your slides?
Yes, I think a lot of this I've already shared before, and I can definitely share out the slide deck, but here's just a little more information about the 12-month eligibility and how that's protected. And then I think that was it. So definitely you can reach out to me if you have any questions, and I'll pop my email in the chat as well.
Thanks, Jen. So sorry.
Oh, no worries.
We're just tight today. All right, our next presentation is on family preservation. Is Mary or Jennifer here to do that presentation?
I'm happy to get us started.
All right, thank you.
Good afternoon, everyone. I'm Mary Geelan, and I use she, her pronouns. I'm the Family First and Integrated Policy Manager with both self-sufficiency and child welfare. I'm working across both programs to look at our policies, funding, and other infrastructure to support keeping children safely with their families and preventing the need for foster care. I'm pleased to be with you today to share some updates as we continue to learn and innovate and move the family preservation approach forward. And I'm here along with Jennifer Holman, so I'll hand it off to her.
Great, thank you, Mary. Good afternoon, everybody. I'm Jennifer Holman. I'm the Family Preservation Manager for both child welfare and self-sufficiency, and I use she, her pronouns. Yeah, so Mary and I wanted to share just a bit of information with you all today about the family preservation work that's happening at ODHS and in the community. So family preservation, which is a partnership between child welfare and self-sufficiency, begins with a vision for transformation. And that vision states that we believe children do best growing up in their family and community. So family preservation is about putting that vision into action. And we're doing that by using values-based engagement. So meaning that we're strengths-based, culturally responsive, trauma-informed, and absolutely family-driven. That we look at concrete supports and connections for families and tailored services that help us build really strong relationships with families, tribes, and communities. And by refocusing and reprioritizing on serving families in their homes and communities, not in foster care. So self-sufficiency and child welfare are partnering and collaborating with communities and community organizations like you all on supporting and strengthening what communities and families already know work in their communities for them, and working together also to address those gaps and barriers so families get what they need, when they need it, how they need it, and who they need it from. So it's been a year since our 3 family preservation demonstration sites, which are the Alberta branch in Multnomah County, the Douglas County branch and Klamath County branch, have started implementing family preservation practices. Parts of those are building stronger intra-agency relationships, community engagement, and intentional collaboration with partners. We're also working on strengthening our practice and decreasing barriers specifically through concrete and economic supports, and creatively enhancing practices to again serve children and families in their homes and communities. So I'm going to talk about a few accomplishments over the past year related to ODHS practice in our demonstration sites. So those are a real focus on the relationship building and strengthening of relationships between self-sufficiency and child welfare, and putting structures in place to support the sustainability of that relationship. The family preservation meetings, which bring together family, their support, self-sufficiency, child welfare, and community providers that support in-home safety planning very, very early in our work with families. We're putting in place shared contracts across self-sufficiency and child welfare to support continuity for families and the services that they're receiving. And we're doing intentional work to understand and address bias around working in home with families of color, to directly address our efforts to decrease disproportionality. And we have found that the number of families able to be served in home by child welfare rather than in foster care continues to increase. And that really one of the most exciting things we've experienced this year was in our Klamath site. Over a period of 8 months, we saw the number of families with open cases being served in their homes more than the number of families being separated by foster care. So I'm going to turn it over to Mary, who will share some additional accomplishments related to you all in the community.
Thanks so much, Jennifer. We believe that in order for families to thrive, they really need thriving communities. So with that in mind, over the last year, we launched a statewide family preservation community partner forum, bringing together community-based organizations, agencies, and individuals to build relationships and a community of mutual support to move prevention and preservation forward across the state. If any of you are interested in joining us in that effort, I'll be sure to put my information in the chat after this, because we'd love to have your participation in that community partner forum. We can't do this work without our partners. We've also worked with the Oregon Health Authority, the Oregon Youth Authority, the Early Learning Division, the Youth Development Division, and across programs at ODHS to strengthen partnerships and focus on prevention and preservation of families and opportunities to support families, including things like policy and legislative collaboration. We've also prioritized funding for culturally specific services and supports for families, recognizing specific needs in communities of color. We've also, through a partnership with the National American Indian and Alaska Native Mental Health Technology Transfer Center, been able to partner and have 8 of the 9 tribes in Oregon participate in training and motivational interviewing. And the last tribe will be going through that training in September. For those who aren't familiar, motivational interviewing is a person-centered evidence-based model of engaging people in change. We also increased community collaboration at the local level in our demonstration sites for family preservation, including holding multiple community forums with over 90 community partners to strengthen and build trust by listening to communities around strengths that already exist in communities and needs and barriers they see in keeping families together. In Douglas County, they developed what they call Teams for Families, which is a panel of providers that meets weekly with the ability to provide immediate concrete assistance to families to support children remaining in their homes. And collaboration is also happening at the local level between ODHS, housing, transportation, and medical providers in a timely manner to try to support families' needs. Finally, I know we're over our time, so I'll just say that we've been working to get our policies aligned with the vision that we talked about of keeping that we know children do best growing up in their families and communities. For instance, self-sufficiency changed its policy related to TANF by assigning 75% of the monthly cash grant to the dependent child or children, preventing sanctions from being applied to that amount. We've also increased clothing alliances and expanded the Family Support and Connections program to include more culturally specific programs. Another example of a policy change in support of family preservation was increasing the TANF resource limit for new applicants from $2,500 to $10,000. As you can hear, much work and progress has been made over the past year. We look forward to deepening partnerships with the community and collaboration between self-sufficiency and child welfare to ensure families we collectively serve have equitable, timely, and relevant support. As we move forward, we will be considering other demonstration sites and look forward to engaging with you on that process. As Jennifer said, these are just some of the accomplishments, and they wouldn't be possible without collaboration with community members and organizations as well. Thank you very much for sharing your time with us today.
Thanks so much to both of you for presenting today. We don't have time for questions. However, if anybody on the call does have questions for Mary or for Jennifer, go ahead and pop those into the chat and we'll make sure that they get answered, and we will send those answers out along with our follow-up email next week. We usually get that follow-up email out within the week. The next piece we're going to have on our meeting was about the website redesign. Sunny, do you have enough time to be able to present? We still have a few more presentations after you. Maybe we can include you again next month so you can talk more about it.
Sure. Hi.
Okay.
Hi, everyone. I'm Sunny Pettit, Communications Officer for ODHS. Pronouns are she, her. And I'm just going to pop really quick some information into the chat that I think will be useful for everybody. Boy, that's a lot of information. That's the longest chat you've ever seen here, I think. But we've got a lot of information. We're doing some great stuff with our redesigning of the website, basically trying to make it mobile friendly, easier to navigate, less, more language that is helpful for people to find what they need quickly. And I also am seeing that those links didn't go through, so I'm going to add in the link to our feedback form for partners. So if any partners do link to ODHS, we would love to find out what those links are, and I'm going to put that link into the chat and would love to find out. We'll send some information over to you so that we can make sure you've got that new link ready to go on the morning of June 28th. And then next week, we've got a Spanish information session for partners that's scheduled on June 13th from 11 to 12 p.m. And yeah, would love to find out more if anyone's got questions. We're really looking forward to debuting this, but we always are going to continue working on making our site better and more accessible. So thanks, everyone.
Thank you, Sunny. Sorry to make it a rush for you. It looks like since it's launching the end of this month on the 27th, that maybe next month you could give us a tour during this meeting. That might be a really nice way to be able to finish up your presentation and help everybody understand and see all the great changes. All right. Next, we have some SNAP updates to share with you. Antonio, are you here?
Yes, hi. Let me go ahead and start sharing my screen. Let me know when you can see it.
We see it.
Okay, so basically, there's a few things I just wanted to bring up and remind of changes that are occurring in SNAP. So the first one is in regards to the SNAP replacement of benefits lost due to electronic theft. The plan was approved to start May 23rd, and so we're asking people, it requires that people report within 30 days that they discovered that they had benefit lost or benefit theft due to this reason. We are limited to 2 issuances per federal fiscal year. And we are limited also to the lesser of the 2 amounts. So I just want to explain, if a person experienced electronic theft, their prior 2 months of SNAP issuances can be replaced, or the actual amount that was stolen. And this will depend on whichever is the lesser of the 2. If a person experienced thefts after October 1st of 2022, they need to report those losses by June 31st of this month in order for us to be able to replace them. So that's something that I want to mention. And if they had previously reported this loss, and we pulled the list from prior denials before we were able to replace these benefits. And so we're trying to go back and make those replacements based on the information that people already submitted. But if a person wants to make sure that their benefits get replaced from prior to May 23rd, we're encouraging everyone to just give us a call and make sure that they provide us with the information needed. The second thing I want to mention for SNAP, because of the public health emergency declaration being over, we're phasing out the 2 temporary student exemptions that were in place. One was the expected family contribution of $0 and being eligible for work study. So we are phasing these exemptions out for new applications. But if they're not reported by the 10th, we won't be able to use them anymore. For renewal applications, they have until the end of the month to be able to report them so that we can continue to use them for their next certification cycle. If we do end up using those exemptions, they will be carried for the duration of their certification period. And one thing that I want to mention is there's many other student exemptions, regular student exemptions, that are not going away. Those are still being in place, and we're still screening students of higher education to make sure that if they are students of higher education and they meet any of the other regular exemptions, we can continue to make them eligible for SNAP if they meet the other SNAP eligibility criteria. And finally, because of the public health emergency declaration, we have the start of work requirements for individuals with an ABOT status. And so I want to make sure that we point out, if someone has an ABOT status and there's no minor, because they do not have a minor child in their home and they meet the age range, the work requirements still don't apply if they meet one of the allowable exemptions, including the 3 new exemptions that were added as a result of the Fiscal Responsibility Act. If they live in a waived area, also they are not subject to the work requirements. And if they age out of the ABOT status group, or there's a minor child now in the home. For those who live in Clackamas, Deschutes, Lane, Lynn, Marion, Multnomah, and Washington County, we are providing referral services so that they can connect with the Oregon Employment Department and receive individualized case management services. Those who live in Benton, Columbia, Hood River, Malheur, Polk, and Yamhill counties are being screened for any exemptions that they may meet, including discretionary exemptions. I want to remind people that we are sending another set of notices to those who are impacted directly at the end of this month so that they can connect to the ABOT team. I'm including the ABOT team's contact information, who again is doing screening for exemptions, giving credit for work activities people may already be doing, or referring to OED case management services if appropriate. And again, as a reminder, OED case management services include an individual SNAP coach who will help create a case plan so that the person can meet the work requirements. And those who do engage in the services through the case manager will also have access to support services, which include things like transportation support or funding that may be needed so that they can participate in the work activities. So that's all that I had.
Thank you, Antonio. I can tell you were trying to get through it as quickly as possible. I appreciate it. I know we don't have time for questions today, and I'm sure some of you have questions. You're welcome to type them into chat, and we will get those questions answered and sent out to everybody. I also wanted to invite everyone, if you are not already attending our SNAP partner meeting, to attend that. It's in 2 weeks. It's at the same time, and it will be a great time to also ask questions as we'll be reviewing this information and we can go into more detail. So if you have that interest and you're not already on that invite, feel free to put that interest in chat. We'll get you that invite. All right, last but not least, Jen. We have another Jen. Jen is going to present to us a real important update.
Yeah, there's always a lot of us. Thank you, Misha. For those of you on the call who don't know me, my name is Jen Corbridge. I use they, them pronouns, and I work in self-sufficiency programs at ODHS. I'm just going to talk a little bit today about what Antonio sort of preambled was the Fiscal Responsibility Act of 2023. Terrible name. So there were some provisions within that bill that impact both the SNAP and TANF program, and I'm going to briefly kind of go through those because I know we don't have a lot of time. I'm just going to quickly share my screen. So can everyone see my screen? Okay, great. So I won't get into too much detail about some of these provisions because some of these are purely programmatic. So the big one here with respects to impacts to SNAP is that the work requirement for individuals without dependent children was expanded. The age requirement was expanded to age 54. That was originally in the first version of the bill 55, but Democrats, I suppose, got it down to 54. The age requirements are going to stage in, I think, in 3 iterations. Age 50, 90 days after passage. So the bill was passed a few days ago, so 90 days after that, up to 52, I think, in October, and then to 54 in October of 2024. So they're staging that in. The bill expanded work exemptions for able-bodied adults without dependent children for 3 populations: folks experiencing homelessness, veterans, and foster youth aging out of foster care, which is great. Though I will add, and many folks were probably eligible for that before, but this legislation explicitly calls that out. The bill also reduces the state's ability to levy discretionary exemptions for people who are experiencing specific hardships. That exemption rate goes from 12% to 8%, and it prevents us from banking. Normally what happens is we're able to, when we have a certain number of discretionary exemptions, we're able to roll them over to the next year. That practice will end with this legislation. For respect to TANF, the caseload reduction credit basically might enable us to reduce our work participation rate, making it easier for us to meet our work participation rate, which results in us not getting penalized, which when that happens, a portion of the block grant is taken, or I think we have to pay back the general fund. And I think Annette's on the call, she can speak to that better than I could probably. The way that we meet our work participation rate in Oregon is we issue small payments to SNAP families. The legislation basically doesn't prevent us from doing it, which basically existed in the first iteration of the bill. But in order for us to do it, those payments have to be at least $35. And there are a couple of other provisions, new reporting requirements for us, which I think we're going to get more clarity on when we meet with the Office of Family Assistance. And then there's a pilot program that's looking sort of at the future of outcomes and how we sort of measure work requirements. The pilot will include 5 states, but we don't yet have clarity on how one participates in that conversation. So more on that later. I know that we are out of time. Does anyone have any questions? And again, I'll throw my email in the chat in the event that a question does come up.
Thanks, Jen.
Thank you.
I'm sure we'll have more information on this as time passes, and we've had a chance to really look into everything fully. So more to come. Thank you all for being here today and for getting through. There's a lot of information for us. So I apologize there wasn't more time for questions. Do put any questions you had in the chat and we'll get that information back to you, or feel free to reach out to me directly and I will try to get that information out to you as well as everyone else on the call so that we all have access to that information. Have a great day and we'll see you again next month. So Patty, I think you're okay to stop the recording at this point. The meeting is concluded. Thank you so much for your help today.